guys, it's Tara, and I've been basically paralyzed from my waist down at level T11 for 4 months now, so there's no sensation down there, but I'm making this video to kind of talk about other changes besides just paralysis and lack of sensation that happens within like the first 6 months or so after spinal cord injury. And I apologize in advance because I stumble over my words horribly. First of all, as you may have guessed from experiencing a spinal cord injury and paralysis, you lose your muscle, and some people lose more than others. I actually used to be, I'm 5'1", so I used to be like, my weight fluctuated, but maybe like 110. I think I was 110 right before my accident because I actually had a doctor's appointment that day, so I know how much I weighed. And then I recently was weighed with like a special wheelchair thing, and I was only 102, so I lost like probably 8 pounds in muscle, although it's not super noticeable unless I wear jeans that I used to wear before my accident. However, even though I lost muscle and like therefore weight, I guess, there's still swelling in my back from my back surgery where I had 2 rods placed to stabilize my back. So that is still a little swollen even though it's been 4 months. And also when my bladder is really full and I need to cath, my stomach actually like gets bigger. It's called stomach distension. And it was really weird at first. I really thought that like I had somehow gained a lot of weight laying in a hospital bed doing nothing and eating nothing for days. Speaking of my incision on my back, I have a really long back incision. I might insert a picture. I also have a much smaller incision along like between my ribs where I had a chest tube. But my back incision itches sometimes and I have no idea why, but it's just really strange. Also, only my left leg gets really cold, and it gets like progressively colder as you go down from like my thigh to my toes. It just gets like freezing cold, and it's not all of the time that it's super cold, but it's a very big portion of the time, and it's only my left leg. I also suffer from a lot of blood pooling, so my foot actually turns like purple, like a really like nasty color, and like a lot of dots on it. So especially when I get out of the shower, I don't know why. Maybe it's because of the warmness. Something else that kind of changes after spinal cord injury is your bladder and bowels. So my bladder, it's called the neurogenic bladder, and there's 2 different types of neurogenic bladders. I think I was told that mine was a flaccid bladder. So I'm not spastic at all yet. So my bladder doesn't like do this motion all the time. So if your bladder is constantly spastic and just like squeezing on itself, it's gonna let a little bit of pee out like all of the time. My bladder isn't that way, but I do like once I get too full. So obviously I can't tell when I'm full. There's no sensation. So I catheterize myself intermittently about every 3 to 4 hours. So if I don't do that, sometimes I forget. I'll pee just like a little bit. Also, I pee myself when also, I pee myself when I push really hard. So normally, obviously, I'm doing that on purpose so that I can pee. But cathing yourself is obviously a lot more efficient and easier since you have to push really hard to get pee out sometimes. It's like you have to get like dizzy that you're pushing that hard. One thing that's actually probably really disappointing about my injury, and it shouldn't be, but it really is, I used to be really naturally flexible. I never had to stretch myself, so I could just do basically whatever I wanted to do without any kind of practice. So I was in gymnastics when I was little. But after my injury, my joints below my level of injury, so all of my paralyzed joints are actually becoming more stiff and rigid, even though I do stretch them now. Like, I have to stretch them every day at least once, but I try to do it multiple times a day. It's just so hard to remember because I never had to before. And even after stretching them, especially my ankles, they my right one barely wants to go to 90 degrees now. So now I have to get, I think they're called AFOs. They're like ankle braces, so that's really cool. Even though my back mostly isn't paralyzed, I also can't really twist or move that either because I'm fused from T9 to, I want to say, L3, and that's a really large portion of your back that can't be twisted anymore, and my back was one of the most flexible places. Oh, also, when I do stretch myself, my ankles, when I kind of just take my ankle and I just like go like that a few times. Sometimes when I haven't done that in a little while, my ankle kind of, there's no other way to say this, but like it like kind of pushes back. So if this is my ankle and I like do this, sometimes my ankle will try to like do that, and I don't know if that is like spasticity or what. I have no idea, but it was kind of freaky the first time it did it. I also deal with a lot of swelling. So it's mostly in my foot and sometimes my toes and also my ankle. But if it's really bad, it will also go up my calf area and make that calf bigger. And you would expect that because you're not really moving, so stuff's just gonna like get trapped down there. But what's actually weird is that mostly my right leg gets swollen, especially recently. My right leg and foot and ankle have been swollen every day for probably a week and a half. One thing that I'm not quite sure of yet, but that I have read about, is that people may not sweat below their level of injury. So let's say mine is around my waistline. Some people say that you don't sweat below your waist, and I'm not sure if that is like everyone with spinal cord injury or just some people. I really haven't noticed any swelling yet, and it's been 4 months, but it's also been pretty cold outside. But I have noticed goosebumps, which is strange. One thing that's not really weird or strange, more irritating and painful, is nerve pain. So people experience nerve pain differently with spinal cord injury. Some people have it like all the time, some people have it on and off. I would probably say that I'm on and off with it, but there's different types of nerve pain. So I most often get a burning pain in my back, but it's only in my back, but it can last like all day to a couple days. And also I get like sharp stabbing pains in my back, like very like specific places. It's not like my whole back, and that only lasts a minute. Also, I get like a tingling, falling asleep, like static feeling in my legs, especially my left one, which is kind of weird. It's kind of like, nerve pain is like when your body is trying to remind you that something's wrong, but it just never stops. Like, yeah, I know something's wrong at this point. I think I know, but it just never, ever stops.